Have you got some questions on the nursing course that we offer here? This is a perfect stepping stone, perfect pathway on into. The main focus I would sort of suggest is it's a big workload. So if she wants to jump on in and start straight away, let her have some time between when she finishes year 12 and when she starts, because it's 19 weeks, pretty full on.
Okay, yeah.
But it's a beautiful pathway into the undergraduate program.
Yeah.
It gives them their basic nursing skills. They get a really good grasp of the foundation needed from a care perspective for nursing. They also get a lot of the knowledge and skill that they can use going in for their undergraduate program, as well as in some cases they can come out with just as much knowledge as someone after second year in the program at university. So it's a pretty full-on course. But it is a perfect stepping stone if that's what you want to do.
Yeah, so we just...
historically, most of our students struggle with anything more than 20 hours of extracurricular work or whatever it might be. Even though the course is 3 days a week, it's a full-time course load. So if they're not prepared Monday and Friday to be either prepping for the week or finalising assessments and summarising from the week, they're probably not going to keep up. So a full-time course load, but with 3 days of attendance, whether that be face-to-face, online, self-directed learning, those sorts of things. And look, once they complete this course and they register with the nursing board, so they have their diploma, they register with the board, they can go in at second year for undergraduate. So you're cutting a year of HECS off, and they've got ground level experience in nursing care that they can utilise, and they can work as well as study undergraduate. They want to do. A lot of them go, I really like being an enrolled nurse, I'm going to stay here, and they for a couple of years and then wait a few years and then study again afterwards. Especially locally, opening up a lot more opportunities for enrolled nurses. Because they are trained and they come out with their diploma and they've got an education level higher than say 10 or 15 years ago. There's a unit of medication, so safety, efficacy, all of those things. So they do that over 2 phases. They also do a complex unit, so they're in an acute care unit. So they go into the hospitals, into an acute facility, those sorts of things. They have placement out in the community. So in Mildura, the campus, we take 25 as max, and in Swan Hill 20. 2 intakes. So the 2 years of the diploma runs over 4 phases, we call it. The first phase, the introductory phase, is 19 weeks of course study, and then we have 2 weeks of what we call preparatory clinical labs, and then they go out for a 2-week placement in aged care. Phase 2, we start building on those foundation units from phase 1. They do a mental health unit here, as well as we introduce them to medication safety, knowledge. Does this lead into midwifery? So this course can lead you to midwifery. However, you must be a registered nurse to go on to postgraduate midwifery studies, or there are university courses that you can do a combined nursing, come up with a nursing degree as well as midwifery. So this is a basis for the diploma if you wanted to then go on and become a registered nurse. So after this course you register as an enrolled nurse. If you wanted to then lead on into university, there's certain universities will accept you into their second year program of undergraduate studies for nursing. This is study all on campus. So at the moment we're a mixed mode type of delivery. Obviously, we follow DHHS guidelines and the guidelines in relation to the safety during the COVID. So we have some skills that are delivered here on campus, and then we have Zoom online sessions as well as self-directed learning opportunities. So it's quite a mixed delivery method at the moment. The placement, however, is obviously not on campus, and that obviously could happen anywhere around country Victoria in essence. And obviously with our campus facilities being between here, Swan Hill, Robinvale and Horsham, we could be placing our nursing students anywhere from a health facility around that regional area. Prerequisites for the course. Okay, so obviously there's the ACER examination. So you'll be organised to partake in those. So there's obviously a mathematical one and an English grammar type questionnaire that you must complete those, and there's a certain level that before you enter on in. Then there'll be an essay requirement to write, and then you'll sit an interview with one of the nursing staff or the head of discipline, whether it be here for the Mildura intake or at Swan Hill. Obviously, if you are an international student, there are some requirements that the Nurses Board stipulate, and those are obviously IELTS, English equivalent testing, that if you are not, don't have it, I think it's 6 years, don't quote me on that, of education within the Australian education system, then you're required to sit those examinations. And again, that's directed purely from a nursing registration focus, that you must sit those prior to enrolling in the course. And being 18, that's the other prerequisite. You have to be 18 to be studying. So if you're 17 years and 10 months, and we could inquire about whether we could get you in, and if there's a position for you, so that when you're out on placement, you're definitely of the 18. Is this covered under free TAFE? Yes, the nursing course is one of the free TAFE courses, so very fortunate. However, there obviously are materials that need to be purchased or acquired for the students, from textbooks. You'll be required to purchase a uniform. All of our students have a nursing uniform. At the top, they purchase with the Sunny TAFE logo and the student logo on it, that is to be worn both in class and whilst they're out on placement, as well as requirements for, obviously, from a work health and safety point of view, adequate shoes. So we look at enclosed leather shoes, pants, proper pants, not leggings or things like that, for either the male or the female student, and then a skirt below the knee. We also look at students have to purchase a name badge, so that, and then there's material costs, and they are all discussed at enrolment. Our enrolment officers can assist with extra information about that. Just give a bit of a spiel on our placements. So there are 4 specific placements over the 2 years, and the first one is obviously in aged care. Our second one is our mental health placement. And then in the 3rd and 4th phase, there's acute care placements, and they're traditionally at an acute facility, as well as a week of community care, which encompasses obviously primary health, general community care, and palliative care. So we circle the whole gamut of all the nursing perspectives to give the student a full range of experience, to not only from a skill perspective, but from a knowledge base as well. Our next intake is January 2021, if anyone was looking at that. So the first placement in phase 1 is 80 hours of aged care. And then in phase 2, there's another 40 hours of aged care and 40 hours of placement. So phase 1 and phase 2 are traditionally Monday to Friday morning shifts. And then come phase 3 and phase 4, when we look at the acute care placements, and in phase 3 our acute placement is 120 hours, and in phase 4 it's another 120 hours of acute care, and then a 40-hour community placement. And some of the students have experienced in their acute care placements shift work, afternoon and evening and night shifts. They've also looked at working weekends as well. So they've had a complete nursing experience in their acute care placements. Obviously, with the 2 years of the program and the phases that it is, the school holidays, we don't follow in from the school holidays like they do at other TAFE courses, because of the way that the placements are structured. So even though we set out, for example, in our first phase, we might set out an 8-week space for our placement to be completed, the students will only have 80 hours within those 8 weeks. So there is some possibility of some free time. However, the dates for their placements are obviously dependent upon the facility that is taking those students. So they don't usually have a planned holiday as such So the program is delivered, it mirrored exactly the same between the Mildura campus and the Swan Hill campus. Obviously, the Swan Hill students would possibly go on a placement a bit closer to Swan Hill. However, we've had Mildura students go on down to Kerang, Kahuna and Swan Hill. So it goes sort of both ways, because as we are one big sunny TAFE. There's also a first aid unit component within the first phase, so we can give the students the knowledge and the ability to apply skills from a first aid, emergency, basic life support type, give them CPR instruction and assessment on that. So they're definitely well prepared to go out on their first placement. I'll just say, if anybody was considering it, it's a big 2 years. Our first group of students are just about to go off on their final placement, and they're very excited, in hoping to finish up and become registered nurses in the enrolled nurses in the very near future. So I would say, if anyone's thinking about it, it requires a full-on effort for the 2 years, because it has quite a bit of theory base behind it, and obviously we're going to train the best nurses that we can, because we want you to be out there looking after us when we all get older or unwell. Thank you. All right, well, maybe I'll see somebody or somebody's children or friends in the course in the very near future.